All right, and I'm going to share my screen. Okay. All right, so as Jennifer said, we will be giving you an overview of our HealthySteps model. We'll share a bit about evaluation and the evidence of HealthySteps. We'll talk about policy and finance specifically as it relates to what's happening in California, and share with you an exciting funding opportunity for sites in LA County. We will be going through this presentation and saving questions for the end, but as you have questions, you can put those in the chat and we'll be sure to make time to get to them. So, what is HealthySteps? HealthySteps is an evidence-based program that resides within the primary care setting. It is evidence-based, it's interdisciplinary, and it promotes nurturing parenting, and healthy development for children birth through the age of 3. A key component of our program is the HealthySteps specialist. This is an expert in child development who is integrated into the pediatric team to provide short-term consultations and support for families who are at risk. Because HealthySteps is embedded in primary care, this allows for nearly universal access to children birthed through the age of 3. And this is a population that is sometimes harder to access for preventative type services, as they're not in childcare and they're not in school yet. So it makes a lot of sense that our program is housed in places where well child visits are taking place. Nearly all families take their children to well child visits, and parents often report feeling like good parents when they take their child to the doctor. Families regularly rate pediatricians as highly trustworthy in a place where they can seek advice to be the best parents that they can be. Going to a pediatrician's office or a family practice clinic is a non-stigmatizing setting. It also offers a lot of availability. During the first 3 years of life, a child will have up to 13 well child visits. So that's a lot of opportunity for us to engage with these families. The HealthySteps National Office developed a tiered model of care that connects each family with supports and services in response to their unique needs. HealthySteps offers an array of services to meeting families' needs through a risk stratified approach. So our first tier are universal services. This means that we want all children aged birth through 3 and their families to be universally screened for risk factors, including development, social emotional development, as well as social determinants of health and protective factors and maternal depression. We also want those families to have access to our HealthySteps specialist through a child development support line. Now that we know by providing screenings to all of these children that there could be concerns or that get brought up in those screenings. So the HealthySteps specialist in partnership with the provider can offer child development and behavioral consults to address those discrete concerns. When families have discrete concerns, they can be assessed by the HealthySteps specialist, and then that specialist can offer care coordination and service navigation to make sure that families get the referrals that they need, and those referrals are followed up on in an effective and efficient way. Now, in our clinics, we all have those families that are most at risk. And so in addition to providing universal screenings to those families and short-term supports when needed, we want to follow those families through the course of those first 3 years of life. We want to make sure that we are, the HealthySteps specialist and the provider are providing ongoing preventative team-based well-child visits. This proactive approach is meant to prevent risks to the child and family from becoming a reality. Our core components are our activities within the HealthySteps model. So I've told you a little bit about universal screening. We want to screen for typical and atypical development, as well as social, emotional, and autism screenings. But we also want to screen for family needs. So looking at things like maternal depression, housing needs, food insecurities, things like this. We want our families to have access to ask their questions and get support when needed. Again, offering those behavioral consults when needed, and during those behavioral consults that we're doing positive parenting guidance, as well as providing information about early learning resources. And then for those families who are most at risk, we want to make sure that we are doing preventative team-based well-child visits. So that family can expect to see not only the provider during visits, but the HealthySteps specialist to bring up any concerns or even to provide some anticipatory guidance to the parent about what they can expect next in their child's development. As I mentioned before, HealthySteps is an evidence-based model. We have looked at a variety of outcomes in our program. Now, we won't be able to get through all of these today, but I will be putting links in the chat so you can explore our complete library of evidence base on your own time. But we did want to highlight a couple of our outcomes that we thought you guys would be most interested in. And those are screening in connection to services, social emotional development, maternal depression, and then practice and provider impacts. So Jennifer is going to take us through some of those outcomes now. Jennifer?
Absolutely. I won't go into much detail on these slides, but I just wanted to hit some of the highlights here. HealthySteps has a really wonderful ability through the partnerships and the relationships that HealthySteps specialists establish with families to identify those early needs that often pop up with children and families, and then to connect families to those resources. We know that from our previous randomized control trial, children are 8 times more likely to receive a developmental assessment. They also had higher rates of developmental referrals. And across our network, the median age of autism diagnosis for children who screen at the high risk level was 2 years earlier than the national median. So for those of you familiar with autism diagnosis, you know the earlier that you can diagnose, the better, and connect families to resources. We also have high rates of connections to resources. So HealthySteps families have significantly higher rates of non-medical referrals when compared to non-HealthySteps families. And then mothers also have significantly higher rates of maternal depression referrals and were 4 times more likely to receive information on community resources. So again, we know a referral is only as good as a piece of paper. And so our specialists do a lot of work to provide warm handoffs to families, and then also do closed loop referrals in the back end to make sure that families are actually receiving those services. On social emotional development, of course, Amy mentioned the screenings that play such a key role in HealthySteps. But we do know that our HealthySteps children have a higher rate of referrals for social emotional challenges. Our families also report receiving more anticipatory guidance on child development, which is critical because a parent who's expecting a 1-year-old to have the skills of a 2-year-old can present some real opportunities for HealthySteps specialists to provide some much needed guidance to families in partnership with the pediatrician. HealthySteps families also demonstrate a significantly better understanding of infant social emotional development, and parents were more significantly likely to notice behavioral cues and provide age-appropriate nurturing. So again, a lot on social emotional development, not only of the child side, but a lot of education on the caregiver side as well. On maternal depression, HealthySteps moms were significantly more likely to discuss their depressive symptoms with HealthySteps specialists, and pediatric providers were significantly more likely to discuss postpartum depression with mothers. And one of our favorite examples is from one of our sites in New York City, who was very reluctant to screen for maternal depression in the pediatric setting, but did so as part of implementing HealthySteps, made a comment that before HealthySteps, none of their mothers had maternal depression. So obviously we cannot assist with what we can identify. And so one of the things obviously that we really emphasize with our HealthySteps sites is screening for maternal depression, and then of course making those referrals to sources within the community if HealthySteps specialists find that they need additional resources. And then it's not only families that benefit from HealthySteps, practices and providers do as well. We have a million testimonies from families who appreciate the assistance that HealthySteps has given them. But on the provider side, physicians report significantly higher satisfaction with HealthySteps. They also feel emotionally supported by the HealthySteps specialists. And I will say that has been especially true in the time of COVID. Our HealthySteps specialists have not only been a resource for the families that they work with, but also for the clinicians and the pediatric providers within their sites. And then finally, just important to note on the cost, one HealthySteps practice that serves a diverse pediatric population found that their estimated cost averted exceeded the program operating costs. And I'll talk a little bit more about the return on investment and some of those numbers that we found in just a few moments.
Most recently, HealthySteps was in the news in LA County. The LAist did an article on our model. And I think this is really a testament to how our program impacts communities. And so we encourage you to find that article. I'm going to put a link in the chat to a couple different news or HealthySteps articles that have been in the news as of late. But this one in particular not only gives the perspective of the HealthySteps specialist, but also a parent who received those services. And it's really heartwarming to kind of hear that kind of testimonial. Not only does HealthySteps impact the outcomes that Jennifer shared with you, but HealthySteps also works to advance health equity. And Jennifer is going to talk more about that.
Sure. Thanks, Amy. We all know that children living in families with low incomes, children of color, they face the biggest obstacles such as low birth weight, unstable housing, and limited access to early learning resources. And so HealthySteps can actually address a lot of these issues and in fact prevent a lot of issues from occurring in the first place for babies, toddlers, and their caregivers, because we know that healthy families have healthy babies who grow into healthy adults. And we also know that just around the time that the brain is developing most rapidly, HealthySteps can bring a focus to the important arrays of skills that are needed for families to foster healthy child development and lifelong well-being. And that, of course, can lead to improved health outcomes, especially in areas where there have been persistent inequities for families of color or those with low incomes. We actually have evidence on our HealthySteps website, and so if anyone's interested, we can certainly share that for each one of these areas that I think are really critical to meeting families' needs. As I mentioned before, HealthySteps is a low-cost intervention and actually saves state Medicaid agencies money in the short term, which for those of you who work with Medicaid is a pretty significant fact. In working over the past several years with Manat Health, our national office found an average annual return on investment of around 160% across our various cost-save analyses to date. So what that means is for every dollar invested in HealthySteps, almost $2 in savings is realized by the state Medicaid agency within a year. And some of those interventions that our specialists provide help to drive those cost savings. And those include interventions around the timeliness of well-child visits, improving immunization rates, and particularly the influenza vaccine. And I would dare say a lot of our specialists these days are talking to families about the COVID vaccine. We also see savings from the education that we provide to parents on the importance of early dental care and making sure that those earlier dental visits happen. A lot of our HealthySteps specialists provide referrals and connections for those services so that we can convert children to earlier dental starters, which, as some of you may know, is a significant issue within the Medicaid space. And on the adult side, our HealthySteps specialists can drive increased cost savings around support for breastfeeding, so including longer duration, referrals for support. Many of our HealthySteps specialists are actually lactation consultants. And in addition to that, providing screenings, referrals, follow-up for maternal depression, intimate partner violence, unhealthy birth spacing, and smoking cessation. And interestingly enough, for unhealthy birth spacing, what we've found is that because our HealthySteps specialists develop such strong relationships, oftentimes with the mothers that they are seeing after babies are born, they're in a unique position to work with and speak with those mothers and even caregivers about plans for future children, their desire for family planning assistance and referrals. And because we know so many moms miss that 6-week postpartum visit, our HealthySteps specialists can help in and provide a little bit more support for moms. And so in some of our HealthySteps sites where there's co-location, for adult and child services, such as federally qualified health centers, our HealthySteps specialists can oftentimes walk moms over to receive family planning services on the same day or a referral and help link mom. And so a lot of, I think in addition to that, just a lot of powerful dyadic opportunities for the specialist to provide assistance to the caregiver in the guise of the well-child setting. Our next slide, I'm just going to briefly highlight. There are opportunities, obviously, for cost savings beyond Medicaid that I think are just important to note. HealthySteps is associated with a lot of positive things, not only the physical side, but the behavioral health side, because we focus so much on early learning, obviously school readiness, and then overall state spending. So if you're interested in any more of these long-term cost savings, let us know and we can certainly provide that information. Moving on to some of the exciting things that are happening in California. There's been a lot that's been going on around family-based services, and our national office has been fortunate enough to collaborate with several partners on the ground in the state to help advance some of these pathways. In late 2019, our national office co-created a dyadic payment proposal with some of our California partners for Medicaid health plans in San Francisco County to pay for HealthySteps services that are not traditionally reimbursed under our current healthcare system. So those would include some of the services in our Tier 2, Tier 3 that Amy highlighted. And mainly because these services aim to prevent future behavioral health diagnoses in children. Preventive behavioral health services are not typically reimbursed in our current healthcare system. So the proposal really outlined the value proposition of HealthySteps, including, of course, that the model is low cost, it's evidence-based, there are dyadic short-term savings available from the model. As Amy mentioned, it's positively stigmatized and it's delivered in a universally accessed setting. And it really creates this unique opportunity to address child development and well-being at the same time as addressing caregiver issues, which can positively impact both child and adult outcomes. So out of this proposal, subsequent discussions in 2020, San Francisco Health Plan approved a first ever payment methodology to University of California, San Francisco for preventive behavioral health well-child visits. So something that hopefully is new to a lot of you, but of course we do those quite a bit in HealthySteps. They had to be delivered by a licensed behavioral health clinician, which many of our HealthySteps specialists are, and the visits could be in conjunction or separate from physical health well-child visits. And they would allow for a focus on both physical and behavioral health of a child and a caregiver, ultimately recognizing true mental health parity. We were actually able to share that innovative San Francisco Health Plan payment arrangement with Medi-Cal, California's Medicaid agency, in late 2020. And that helped to pave the way for bringing this type of benefit more broadly to the state of California. And so May of this year, as some of you may know, Governor Newsom announced an introduction of a first of its kind dyadic Medicaid benefit. So in June, the governor approved $800 million for a new dyadic services benefit that will include integrated physical and behavioral health screens and services for families based on the HealthySteps model. So super exciting, a lot of wonderful progress for children and families. And Medi-Cal is currently working to define that overall benefit, including the codes, the rates, and the estimated timeline for rollout is sometime in 2022. And just a quick note, because I think it's just as newsworthy, in July of 2020, some of you may know that California Medicaid expanded its family therapy benefit to no longer require a behavioral health diagnosis to access family therapy services. So children and caregivers can now receive these critical supports if certain needs are identified, including food or housing insecurity, foster home placement, etc. So if you haven't seen the guidance, I would encourage you to, because it's super exciting. And I have to say your state is really leading the way. And we've already seen Massachusetts follow suit, and a couple others are considering replicating what California has done. So on the next slide, it talks a little bit about our current HealthySteps California footprint. California is home to 1.4 million babies, 2/3 of whom are children of color, who, as we all know, face structural and systemic barriers to optimal health and well-being. We also know that within Los Angeles County alone, there are 500,000 children under age 5. And I have to say, that's more babies than a lot of the states that we work in. So just within one county. And we also know that the first 3 years of life, as Amy has shared, really set us up for a lifetime of health and well-being. So it's really a unique opportunity to support families in fostering their child's health and development, and truly change the trajectory of thousands of children's lives. So this, coupled with a new state payment for HealthySteps services, and a couple of combinations, as I mentioned, that new expanded family therapy benefit, can help to close the equity gaps that persist in California around health service delivery and across our country, and really lays the groundwork for HealthySteps to expand beyond Los Angeles County. Our current HealthySteps network, as you can see, reaches approximately 30,000 children within 15 sites. And we have some upcoming sites that we are excited to share more with you about. So part of that upcoming site count includes the opportunity to bring HealthySteps to Los Angeles County. And part of our strategy is really to focus on statewide sustainability, provide technical assistance to HealthySteps sites regarding billing and taking advantage of some of those new Medicaid coding options that I mentioned, and supporting the onboarding of new HealthySteps sites across Los Angeles. And so really to maximize the impact and stretch the funding that the Conrad and Hilton Foundation is so generously providing to support bringing HealthySteps to Los Angeles County, we are designing a request for proposal process to assist with site selection. The funding allocation has been designed and developed with a baseline assumption of 6 new HealthySteps sites in LA County, I will say needing everything from soup to nuts. So in other words, funding the costs to cover the Healthy Steps specialist salaries for 2 years and inclusive of the Healthy Steps training cost. But in order to maximize the funding and stretch the dollars as far as possible, because we really do want Healthy Steps to reach as many children and caregivers as possible, we are encouraging applicants to really think about their current staffing and identify what exactly they would need to become a Healthy Steps site. So for example, are there existing staff members that are within your clinic that are maybe already doing some of the core components, similar to what Amy has described, that we can train up to be a Healthy Steps specialist and spend part of their time serving children birth to 3 and their families? And so if so, perhaps the funding that your site needs is really just covering initial training costs and half-time support of a staff person, or maybe no support of a staff person's time at all. So it's just helpful, I think, for everyone to think about their internal capacity that they have on staff. And if that isn't available, then what you would need to make that happen. We anticipate releasing the RFP in early January, and we will be hosting a more detailed Q&A session on January 19th once the RFP is released. And then finally, we anticipate onboarding, training new sites in the spring and fall of 2022. So sites will be trained either in the spring or either in the fall. You don't have to attend both of those. And we are really excited that this training and funding opportunity should help us reach more than 12,000 children and families in Los Angeles County. So thank you again to the Conrad and Hilton Foundation for this generous funding. And we're so excited about partnering with some new Healthy Steps sites. And with that, I will turn it over to Amy to wrap us up.
Absolutely. So again, this presentation was just kind of an introduction, a teaser, if you will, about Healthy Steps to get people excited. If you are interested in learning more about the Conrad in Hilton funding opportunity, you can stay connected, and I'm going to put a link in the chat where you just give us a little bit of information, your email, etc., and we will send you updates about that funding. We are so excited to be kind of launching this as a national office. We have this goal to reach 1 million children and families by 2032. And we are so excited that LA County can help us reach that goal. So with that, I am going to stop sharing and stop recording, and we will open it up to questions.
Amy, it looks like there is one in the chat from Janine around when is the deadline for the proposals